Good afternoon, everyone. My name is Dr. Sharnita Rice. I am a nurse practitioner by trade. I've been a nurse for 17 years. I used to work on computers before we started on the network back when DOS was just meeting Microsoft, and we were just pulling in the networks. Now I'm the CEO of Reassured Workforce Solutions, where we bridge the gap between cybersecurity and healthcare. At the heart of Reassure Workforce Solution lies a steadfast dedication to patient safety, security, and patient outcomes. We, we deliver innovative solutions that protect patient data and medical devices while ensuring exceptional care through quality, compassionate support.
Hello, my name is Nakia. I am the COO of Reassure Workforce Solutions. I am an entrepreneur by trade. I worked in the healthcare field. It's been about almost 20 years now. I worked from everywhere from doctor's offices to hospitals to pharmaceutical, been all over the place. And PHI was the number one thing for every position I held. And I'm glad to be here today. I'm looking forward to it.
And we want to thank you all for joining this vital discussion on protecting patient health information in the digital age. With the increasing complexity of healthcare data systems and cybersecurity threats, it's crucial that we explore how best to safeguard patient information, ensuring privacy and security for every individual. So we want to begin today's conversation with introducing our panelists, and then we'll begin to ask questions that we've prepared. And we want you to feel free to chime in, and please put your questions in the Q&A, because at the end we will have a question and answer segment. So we want to start with Julia. Julia, can you please introduce yourself?
Well, thank you for inviting me. My name is Julia Komisarczyk. My background is AI. I've been in artificial intelligence for the last 20 years and have 10 US patents, and degrees in mathematics from UC Berkeley and computer science from Cornell University. And I'm CEO and co-founder of a company called Glender. And Glender's focus is to develop software which automatically and at source de-identifies protected health information from multimodal medical data.
All right. Ramesh?
Hi, I'm Ramesh Valluri, and I've been in the IT industry for about 2 decades with the most, what do you call, eventful thing as the 9/11 tragedy, which I survived. That kind of gave me a greater impetus on what is disaster recovery. And that kind of spread all over into cybersecurity and whatnot. So I come with a lot of background in IT, management, cybersecurity, and I'm currently as an advisor to Harvard University on cybersecurity. And I have a few patents registered to my name. And I think that is what I can say about myself. Thank you.
Thank you.
Awesome.
Mr. Kish?
Yeah, thank you so much. It's a pleasure to be here. Well, my full name is Kedar Akash Khan, and I am the co-founder and the CEO of Diligence System. So Diligence System basically provide medical billing services, I mean the revenue cycle management, as well as the information technology across United States. And prior to that, I worked with a different company. Then I have total 18-year professional experience, starting with the Care Cloud medical billing company, and then the Bulmerex, as well as the Medcare MSO, and I served there as the vice president operation for those 2 companies. That's all. Thank you so much, guys.
Thank you. And we'll have Nakia do our call to action, and then we'll get started.
Awesome. Well, thank you so much, guys, for joining us. We really appreciate having you. We do want to encourage you to learn a little bit more about our company. So here at Reassure Workforce Solutions, we understand the unique challenges you face in protecting sensitive patient information and managing critical healthcare needs. Whether it's ensuring the safety of your data or addressing workforce shortages like nursing, these issues can feel overwhelming, but you are not alone. Our SELECT framework, SELECT stands for streamline, evaluate, locate, engage, customize, and transition, was created with your needs in mind, offering customized solutions to fit your organization's specific challenges. We genuinely care about helping you build a secure, efficient operation that thrives. Let's talk about how we can support you, whether it's shoring up your cybersecurity or filling essential healthcare roles. Reach out to us today at www.reassuresolutions.com. We're here to help you succeed.
All right, thank you, Nakia. This first question I'm going to ask of Mr. Akish. While many of us have a general understanding of patient health information, could you clarify exactly what it encompasses and why it's so sensitive in today's healthcare landscape?
Well, thank you so much, Shamita. Well, that's very sensitive information, I would say. Like, first we need to understand the PHI. What is PHI? That everybody knows that is the patient protected health information. The reason is, sensitive is because everyone is well aware of that. And we do not want to breach, specifically, I'm talking about the patient information like the patient data, including first name, last name, the date of birth, the social. So those are the very important and sensitive information. I do not have the IT background, but since I'm working with the revenue cycle management for 18 years, but I usually train the people or encourage the people that you guys should have the proper compliance officer that should guide the people across the company, across the organization, that you should not breach out the patient health information or the personal health information to anyone, right? So I mean, if you like usually I train the people, like if you are sending the email to the another person, you cannot shoot them an email with the patient name, like the first name and last name or date of birth together, like specifically the social. No, never. So the one of the best thing is that you always encrypt the email, while sending the emails to each other. And even I told the people, when I was working in one of the big companies, that let's say if you're sending an email with the patient data to the another user or to the another company member, you have to protect that sheet with the proper password, and do not send the password in the same email, because it's this possibly there is a reason that might be the password or somehow it can breach out. Always send the password in a very next email. Do not send email on the same the Excel sheet or the Word sheet. So that's very important, because some people do not know how they can protect the PHI, and maybe they do not aware of that. But in fact, in my opinion, every organization, whether it's healthcare or any organization, they should have a proper compliance officer. They should give the proper awareness program. They can, like the weekly awareness program, monthly awareness program, so at least everyone will know that breaching out the PS should cause a lot of issues. That's a huge problem for everyone. So that's important, by safeguarding the thing, how we can protect the PHI. Again, as I said, maybe Ramesh can explain very well, because I do not have an IT background, but there are a lot of precautionary measures we can take. Like as I mentioned, we can protect the patient data properly with encrypted email. We cannot breach out unnecessary information to anyone. We can reach out the information to the covered entities only as per the as per our HIPAA law. And also there are a lot of other options like the data encryption, access control, the regular training, as I said, and that we can regular train to the employees or the within the organization, and then data masking and observation. Those are the things we can definitely, put them in queue and within the organization.
All right. Well, thank you so much for that.
Awesome, Akesh. That is absolutely correct. And I told Sharnita, I said, finally, we have a webinar that I can chime in on. And I'm gonna share my experience before I go to Ms. Julia next, because I think it's important for people to understand when it comes to PHI and how it can be shared and you don't even realize what you're doing. I worked at a hospital, and we had a situation where a young child came in and he tried to commit suicide. And I was devastated as a parent, that this kid was so young and he did something like that. And I did something as simple as going on, I won't say it's simple, but I did something as going on social media, and I just asked people to pray for this child. But because the hospital I worked at was known, and that he committed suicide was said, I didn't say his name, date of birth, nothing of that nature, but I still got called into the principal's office because the way it was explained to me was, well, the hospital you worked at, what the patient, what they were being seen for was something that could have helped identify that patient. And unbeknownst to me, I'm just being a concerned mom, thinking I was doing the right thing, but shared too much information without even realizing that what I was doing. And I think that's important for people to understand, especially us working in that field, that sometimes the slightest little bit of information can be too much to share. Yeah. All right. So my next question is for Ms. Julia. In the context of patient health information, could you explain the key distinctions between data security and data privacy? How do these concepts uniquely impact healthcare?
Well, that's actually an excellent question, because security and privacy go hand in hand, but they're slightly different. And when security means how can we protect the data from somebody from outside reaching it, or somebody who shouldn't have access to it will reach it. Privacy is about how can we usually it's protecting against malicious access, right? Not necessarily, but a lot of times malicious access. Privacy is about how can we make sure that the record in question does not lead back to the patient. So Nikki, in your case, hospital was another thing which should have been de-identified, because then the child would not be identified as easily. It often happens also for rare diseases, where it could be maybe only one patient per hospital. So even though the patient's name has not been discussed, because of the two factors, which is patient's illness and the hospital, it can uniquely identify them. So privacy is about how this information can be tracked back to the patient. And for example, when it comes to security in sending messages, especially when it's in one-on-one communication with the patient, then it's very important to make sure that the data, both at rest and in transit, is actually protected. But when, for example, we're talking about sharing data for research or creating the appeal, right, to support this child, that's where it's very important to have de-identification, because it's not the question of protecting data in transit. It's the question of that the receiving party should not be privy to whose patient are we talking about. So which patient are we talking about? So that would be the biggest difference.
Awesome.
Okay.
Thank you so
Well,
much for that.
Thank you so much,
Sure.
Julia.
Thank you.
So Ramesh, We know that healthcare data breaches can be extremely costly. Can you provide insight into the black market value of PHI? Why is it so valuable compared to other types of data?
See, just like we have the black market, we should call this black market. That means people, for various reasons, they try to make extra bucks by holding on to stuff because they think that that's a wealth that could go up over a period of time. Similarly, patient information is today after IT hacking or what you call financial hackings, patient information hacking has extremely gone up in numbers, whether it is in the number of crimes happened, the volume of impact it has happened over in the last couple of years. And especially with AI coming in, it has been a little more catastrophic. So because there is not much of governance in place, because it's a new toy in the market, given that, going back to your question on what is the impact? The impact is pretty phenomenal and scary on two counts. One is when the patient information in the past, it used to be like, I started urgent care and the next door, somebody's starting an urgent care. They're trying to pull the patients from one to another. They always find other means of addressing that, but not by theft. But in this case, this information, why is there a multifold impact of patient information? Once it is robbed, I can identify the patients. I can do there is a criminal gangs here who live on patient organs. You see? So they just, the number of kids, young girls and boys have been kidnapped for the sake of human, parts or whatever you call it, for such kind of thefts are happening because more and more patient information has been all over the web because of these hackings that have happened with the data.
Mhm.
The problem is, in IT world, we have frameworks and architecture standards. In medical field, it is pretty antiquated and pretty legacy in terms of data security and data management. When it comes to these factors, we are way behind. We are hiding behind HIPAA, we are hiding behind a few other things. But today, there's nothing to say that we can control what information that we can provide, information, because there is a lack of awareness. People have to be educated. One may be a good doctor, but if he is not aware of data security, then you know what is going to happen. Similarly with the nurses. So it is a big challenge, and a lot of education is required here. 2, awareness has to be brought in. 3, new governance and compliance should be in place, new architecture frameworks. I'm sure Julie would agree that we have IT frameworks everywhere, but not in the medical, so-called the IT part of the medical systems. So this is where we need to be very conscious about, and coming up with very, comprehensive security measures, which I think going forward in this conversation, we'll be talking about what I envision and see where we should be going, especially with patient information and patient data security frameworks.
Okay. Ms. Julia, would you like to add to that? Did your graph have numbers pertaining to that question?
Actually, I can give some anecdotal evidence about value of medical health records.
Okay.
So if one goes to the black market, Somebody's credit card report costs $1. If one goes to the black market to purchase somebody's medical record, it will be $250 to $350. So 300x difference. And there is a reason for it. Credit cards, things go well, things go badly, go up and down. So that's something that is transitory. Whereas when it comes to the somebody's healthcare, for example, childhood disease, or whether or not they had COVID, it's there forever. And it's highly sensitive. And it's also something that can be used for blackmail, something that can be used to discriminate. So the information is extremely valuable, at the same time, extremely sensitive. So as a result, that is why there is so much conversation about creating additional security as checks and balances. Right? HIPAA is the step in the right direction. GDPR for European countries, but I think that it's very important for all of us to be aware of how, as patients, of how our information is protected and whether or not it is, and also how can we strengthen that so that our data, our most sensitive data, is not accessed by the malicious actors.
Right. Right. Okay.
Awesome.
Thank you.
Okay. Yes. So our next question is going to be for Akash. Healthcare operates on a need-to-know basis to protect data integrity, especially among clinicians like registered nurses, nurse practitioners, and physicians. How can healthcare providers ensure they uphold privacy even when sharing is necessary for patient care?
Well, I think once again, I would say that every provider, every medical practice, they should have their own EMR system, number one. I mean, if they are doing the paperwork, like most of the provider are using the paperwork, which is not good. Like every provider or the medical practice, they must use the proper EHR or the EMR system. And that EMR system or EHR system should systematically link with them, the practice management software. And you know that the both the information EMR system and the practice management software, every outsourced company or the medical billing services within the United States, they definitely need the access for those software in order to transmit the claim to the insurance company. So this way, there might be chances that patient, the patient data breach out for somehow to the third party. So the provider, the practice need to make sure that they are sending the credentialing information, the software credentialing information to the third parties with the limited access. Like they're not gonna, like if a provider is gonna send us the username and password for me for the EHR software, they only send me the very limited information, even though I'm a third party administrator or something other. But this is how they can make sure to protect the PHI information. They cannot breach out the information that third party do not need that information. The medical records, as everybody knows, that is a very sensitive information. So medical records, if third party need that, yes, provider in practice can breach it out through the proper, again, EHR, the EMR software. And if not, they cannot do that. Again, the better thing is we all collectively as a team need to eliminate the paperwork. And we have to encourage the electronic setup. Whatever the electronic setup, we have to use that. We do not need to use the email that is like the Google emails or the Google something like that. We have to make sure we are using the encrypted email. If we have to use encrypted email. And that's how, the provider, the practice, the staff, the nurse practitioner and the registered nurse, everyone can protect the data. I mean, they are not sure, they are not allowed to breach out the data like any of them represent. Even in my opinion, I usually say to the people, that patient name itself is a PHI, right? So we do not need to breach it out at any cost.
All right.
Awesome.
Julie
Great,
or
thank you.
Ramesh, would you all like to add to that? Thank you so much, Akish.
I would think, I would want to say that there is another use case or another scenario where patient's PHI or de-identification is a very big concern. And that is whenever the data is shared, for example, for AI model training or research. Because there, very much like with everything else, we don't necessarily need to give information about the patient. There might be some information about longitudinal studies and other information, but not that it was John Smith who resides at this particular address. So that's another scenario where PHI identification, especially, is of great importance, because that way we can encourage research without impinging on patients' privacy. So.
All right, thank you.
I think I can add something here. Interesting is one, as I said, sorry if I'm using this word again and again, using the word called legacy. See, this EHR and EMR systems, they might be, top of the line, but then the challenges are always there. You can have a good system, but if people are not following it, institutions or medical centers, they don't understand the importance of a particular tool and technology or system, what happens is they assume that the other side might be having a secure place. So let me securely send the data, but not sure that whether the data that is at the receiving end at rest, is it secured or not? You see? So it is very important that all these paths of various users and consumers, they all have to have one common platform where data in transit is encrypted, data at rest is encrypted, and at the same time, data that is transmitted, if it is to a certain geographic distance, which is probably the long distance between one end of the west coast to the other end of the east coast, in a crazy traffic situation within the web, there is a possibility that there could be some delays. So this is where a good hacker would love to get into that kind of scenario use case and tap into the information. So how do we stop this kind of challenges or threats is by making the data that is transmitted should never go as one big chunk of data. It has to be granularized, and so that it loses its identity when it is in transit. It becomes meaningful only when it is at rest. So, because I worked on a product called InMarge, which was later on bought by Microsoft, which did this, like turning huge chunks of data into small bits and packets and then push it. So if we try to hack into that, it was useless for us, because we know that the end data and the data in transit do not match if somebody want to hack into that. So what I'm trying to say is that there's a need to relook at what we have. I'm not trying to churn the ocean, but I'm being very cautious. And I understand that it needs, because when AI is coming in, it's a train that is coming at such a high speed. And you will see all kinds of problems popping up. Data validity. I would say that if I'm sending some data from me to Akash, and I assume that I'm sending him a genuine data, but what Akash receives is a fake identity. I'm impersonating that data, and I'm trying to send it to him. And he assumes that, oh yeah, it is coming from Mr. X, I know him, so the data is pure. but in reality, the data is not pure. So AI can do all this kind of damage. So we got to be very careful how we want to, start working on without proper frameworks in place, without proper governance and guardrails. It would be, it would be a kind of challenge for more and more cyber threats could happen on patient information systems.
Thank you. All right. So, and any one of you all can answer this question. How does the rise of telemedicine impact the security of patient health information? Are there unique vulnerabilities healthcare providers should be aware of?
Well, there are a couple of things, and it's not necessarily telehealth, but one of the interesting challenges in teleradiology, and that goes for quite a few countries, is that any particular location might not have enough radiologists present, for example, for night radiology. So the reports and everything else has to be sent somewhere else, often to a different country, to be processed. And for those, it's actually very important and quite illegal to share patient information with somebody who not even lives in the same country. So that's one of the challenges that we are seeing through the prism of patient's privacy and PHI identification, where the de-identification of the record before it's sent elsewhere is very important, because quite a few countries do not have enough radiologists. So one has to rely on somebody from the other side of the world to process the information.
So Julia, with that, can you show us through the slides how your company helped with that?
Sure, I don't have the radiology slides handy, but I can
okay.
actually, what I would suggest is, we're talking about what is protected health information.
Right.
But what I would like to do is just to show what is protected health information, because something which is sort of more obvious is when we talk about texts, then it could be, patient name, tabular information that is often found in the EMR, EHR systems. But what about images? What about videos? So
Right,
that's if we have a chance, I want to show a couple of slides about this. But it's yeah. So if you like, I can jump on it right now, or we can find
I
another
know
time.
we'll get there, because
Yeah.
when I think as a nurse, and I know if I'm sending someone out, we have to go to radiology and get their information put on disk. And before we had disk, we just had the radiology sheet. Now it's a way that we have to find a way to remove their patient identification, and they try to remove it, but is it actually removed off of x-rays and CTs and things like that to de-identify that patient, is the question. And I know we're coming up to what do we do when we have to transfer a patient to another facility? How do we ensure that their information is transferred? So when we get down there, yes, we can definitely show those then, okay?
Yeah, and just to point out, there are two different sort of scenarios. One of them is, let's say you're my nurse, you're my treating physician, then information about me, you have full access to it. But what about if it's somebody who is outside of the immediate team, care team? How much information should they have access to, right? It's both security and privacy, because, for example, if somebody's scheduling appointments, they don't necessarily need to know everything about the patient, except maybe their phone number so they can be reached out. So it could be very granular. And once again, that's another example where privacy and security goes hand in hand. Security protects the castle, but how much is exposed in a particular scenario, that's where privacy and different levels of access come to play.
Okay.
Yeah, it boils down, just to add to what Julie said, is people should be aware of it. They should be educated to understand how much is the loss that I can take? What is the maximum hit? So what is the acceptable, what do you call, pain levels that I can go through when some hacking happens or some kind of a data threat is happening? So people should be aware of that and only then, just as Judy said, they call only to ask a phone number and whatnot, but they should also be asking things like, where you are, what kind of, infrastructure that you have in place. Otherwise, if I'm on a dial pad kind of thing with a very lean services in terms of internet, then I'm vulnerable. If I'm sharing my internet, I'm more vulnerable. My data is, can be manipulated anytime.
But one thing to keep in mind, HIPAA, actually, every record leak is a punishable offense, and the numbers add up very quickly. So it's not like we don't have this protection. It's the question of how to make it so that it will be legally compliant with HIPAA, because otherwise there will be fiscal implications. But actually, and that's an interesting thing, even more of a concern for a lot of hospitals. Of course, they don't want to violate HIPAA, but even accidentally, if they leak patients' privacy, patients' information, they're very concerned about reputation damage, because one of the most important things is the level of trust in the institution. And if the patient doesn't trust the institution and providing them with information that might be potentially leaked, that's actually very detrimental to the hospital. So that's even, so we do have certain rails in place, but there's a lot of conversation that we need to have, especially with AI, in terms of what else do we want to do. And also, we don't want to completely abandon the idea of actually being able to share data, right? Because one of the solutions is not to do nothing, but actually it's not a solution, because without it, that's where it gets even more painful, because that means that our diverse patient data will not be accessed for training. And that means that the models that are being created right now with AI in healthcare are going to be biased, non-generalizable, and won't cover most of our population. That's that map that I wanted to show. Sharnita.
That's true, and that was one of our questions toward the end.
Oh, I'm sorry, I jumped.
No.
Jumped the gun.
That is fine. And not only, with research, will it affect research, but it'll affect a patient's care, because we have to be able to share patients' data between disciplines, between specialties. If you're sending your patient to a specialist, if they're having surgery, not at the hospital, but at a surgery center. So it's a lot of different places that we need to. So even though we ask this, I don't think we can completely get rid of sharing patient data.
That's different. That's between, so basically it's two treating physicians. There, it could be a full disclosure. Then the concern is the security, how to make sure that that the data at both parties is secure and in transit and secure. But when we're talking about research in general, then it becomes where one party is actually treating physician and another has no relevance to the patient. And then it's a different use case altogether. And that one is for, let's say, in healthcare training and all the other stuff, because that's the interesting thing about when you're transferring information from one doctor to another, and it's the same, it's a treating physician, the protocol is different. The security is true for both, but the protocol is very different when you're sharing, for example, when you're giving patient information and the patient goes and takes it to another hospital, right? Okay. That's patient's call, it's their data. What we're talking about is more like clinical trials, anything which has to do with more than one patient. Yeah.
Yeah. So another thing I would like to mention, Sharmita, basically, as you mentioned that how we can, because you can and must share the information to each other, because that's mandatory. So those basically in the HIPAA law, those services called covered entities. Like the covered entities means that within the department, the healthcare from the provider, the clearinghouse, the nurse practitioner, and those are the covered entities. They can breach out the data with each other, but again, need to make sure that it's 100% protected.
Yes, I agree. Okay.
So this question will be for Ramesh. How has the role of healthcare workers evolved in safeguarding PHI? What responsibilities do non-IT staff have in ensuring data security?
In today's world of data security within the medical fraternity or the kind of, hospitals or the kind of infrastructure that goes around. Non-IT members are aware of, at least what I see is they are aware of the PI laws and, I'm sorry, patient information laws, what should be exposed, what not, what you can share, what you cannot. The problem here is that that level of knowledge is good enough for securing a lot of patient information assets, but it does not fully give you a confidence that tomorrow, one fine night or one fine moment, a hacker could simply come in and hack into that information. So we, from an awareness point of view, yes, they are good. But the only thing is that we should empower them with more of systems with relative ACLs to be set in place and identify what is important data, what is not important data, what data can be exposed, what data cannot be exposed, even if it is the other side is a practicing doctor or some kind of a lab that is asking for some information. So because the world is changing, technology is changing, and the hackers are also changing their acts. So we got to make sure that people are up to date with knowledge sharing and empowering them with more of these kind of standards, definitions, compliance, and of course, everybody follows a HIPAA. But end of the day, the data, importance is not always around the HIPAA. It is about how I see and what I see the data as important. Your perspective might be different, my perspective might be different from a data security or data validity, or in the sense, the value of the data. So it is very important for people to be aware. It is an ongoing process. People should be educated. And I think it's high time that people should not think that this is not an IT job. It is data. When it comes to data, whether you're a doctor, whether you are a nurse, whether you are a IT guru, you still have to understand all the facets of medical data security aspects.
Yes, yes. Thank you so much for that. So with that said, are there various levels or tiers to data privacy that healthcare workers should be aware of when handling patient health information? And this can go to anyone, whoever wants to answer.
Yes, there are. To my knowledge, right now, it's let me put it this: it is a little bit of a primitive one where we say, okay, if it is a PII, hold on to this. If it is a patient information in terms of the medical records and kind of thing, then you have a different pattern of compliance to be in place. So I think to your question on basically it boils down to what practices are in place, what frameworks are being practiced besides the medical records security aspect. It is critical that data has to be treated not in terms of, when it comes to patient, I see that I have PII information in it. I have, the HIPAA stuff into it. So how do I manage and differentiate? So that means you need to put a clear governance and guardrails of what are the classifications of data. How do I qualify and quantify data saying that it is class A, class B, class C, class D? Define those classes, make sure that everybody understands that those classifications, and accordingly data is saved, making sure at the same time data is not like if I'm putting my laptop and burying it 10 feet deep in a pit is not secured. It's useless for me or for anyone. So I should make it as hard as possible for somebody to access the data. How do I do that? There are various mechanisms in place. As we talked earlier, we said data at rest, encrypted. And if I go back to the state of California, a few years back, they passed a law. It's something called CCPA compliance. Primarily, it means that nobody can share my private data without my permission. Even if I apply for a credit card or something, they hold my social security and other information. But they have no right to sell now or even share it with anyone tomorrow because they need to have my permission. So this is where we introduce something called obfuscation. And by introducing obfuscation, I see the same patterns that can be applied even for medical data. I want to make sure that the whole point I'm trying to make here is that make the medical data as meaningless as possible for a hacker. If I can achieve that, all my problems are solved mostly. But it's not.
Yeah, let me
I'm
take
sorry.
this. What do you mean? Let me take this idea of the let's make it meaningless for the hacker. I agree with you. One of the things is if, let's say, if I show you an X-ray which you cannot attribute to any patient, it's no longer of interest for a hacker, right? It's still of interest for a researcher, but not for a hacker. So there's a fine line of how can we make it so that the data is now safe, as in not attractive for hackers. At the same time, it's still useful for research. And there are interesting, if we go back to the details on each particular modality or each particular format, there are different issues there. But overall, that's a very sound approach, because that way we can make it not as attractive for being stolen. Right? Because then it can be actually shared for medical research, and at the same time not be valuable for going back to that example of black market.
All right.
Yeah.
Okay.
But
Thank
as
you
I
for
said,
that.
I'm always a big fan of showing things and actually going into details, because there's two different things. One of them is more philosophical approach, right? And it's very important to be able to understand the overall structure. But also, what do we mean by let's make sure that the information is de-identified, because then it will become secure. I would love to discuss that, and maybe the audience has some questions about that.
Okay. All right. Well, speaking on that, our question, we have a question, and it's when sharing patient data, what are the regulatory guidelines we should follow? And can we discuss best practices for de-identifying data to protect patient privacy?
Well, if I may, thank you for the question. Let me show some, I'm really eager to show you some pictures. So if you don't mind, I'm going to share my screen.
Okay.
And let me explain what those images are. So on the left, it's actually an X-ray. And usually it's a so-called format DICOM, which actually has pixel data and meta tags. But most importantly, for a lot of medical images, what we have is so-called burnt-in information. As you can notice, there's actually a name of the patient, date of study, and date of birth right as part of the image. So it's actually very important to root it out. So here, you actually have to flip the pixels to make sure that nobody can hack into this image and attribute this image to Douglas Davidson. By the way, this is pseudo-PHI. It was created by NIH to demonstrate pseudo-PHI. So don't worry, we're not showing anything particularly sensitive. But once it's done, then you can actually use the semi-upright portable L, all this very important information for research, while still it's not attributable to any particular patient. So that's one example. Another example is meta tags, or could be any tag. So for example, here we have information about the patient, date of study date, acquisition date, content date, etc. But also we have hospital name and name of the referring physician. And going back to what we discussed before, sometimes hospital is actually enough to, hospital name is enough to identify a particular patient, especially if it's a rare disease or unusual situation, like Nikki, you encountered. So it's very important to de-identify this information. And once again, what do we mean by de-identification is not have the dates, not have the hospital information. And actually quite often we have things like study description, where it will have both very important for research information and the names and other sensitive information which needs to be removed. So that's another example. Another example would be, this is for medical images. I won't show text because we're all familiar with the text and identification. But if we're talking about videos, so here's the video for colonoscopy, right? So we have the faces of the assistant, of the main physician, probably a student physician, as well as the patient. All of this information will actually identify the patient, right? Because facial recognition is very good right now. So it's very important if one wants to, let's say, share this image for research, to obfuscate things like faces, but also you see how nicely all of the sensitive information is right there on the screen. So this information has to be de-identified. Sometimes the patient tag might have some sensitive information, etc. But you see how what we're discussing by de-identification is, how do we make it so that the image is still usable, but at the same time it doesn't lead to any particular patient? That's the goal. Because then, to other speakers' point, then it becomes not very interesting for the bad guys. There's not much you can use here, right? Nothing to blackmail or lead back to the patient. So that's why, but the important thing here is each type of PHI has its own specifics. For example, if we're talking about dental x-rays, if we obfuscate teeth, can identify the person uniquely, as we know from all the CSI movies, right? But if we de-identify all the teeth, then it will be no use to dentists. So this is another one where the decision has to be made very thoughtfully, with guards and rails in place, because who should have access to the dental record and who should not, because dental record, even if we delete all the names, will still lead back to the patient. So this is true for every single, for example, voice, right? One can de-identify references to the patient, their family, etc. But what about voice recognition, where you can actually recognize the person by their speech? So you see how, like, in every single time, it's very important to think through this and have guards and rails. Quite often it's done by RBs in the hospitals, but it's also something that, well, I agree with everybody here on the panel, is something that we all need to think about and be aware as people who are exposed to patients' information.
Awesome.
Thank
Love
you.
the interaction. Love it, love it, love it. Awesome. So on the topic of solutions, we see many products on the market that claim to protect patient data. What are some of the most effective approaches or technologies currently available? Is there a process for classifying data that can help healthcare providers determine the best protection methods? Anybody, this question's up for grabs. Anybody can answer.
I think before we identify a solution, we should identify some kind of a, earlier Julie was saying about the governance and all the nitty-gritty of compliance in place. But to me, the way I'm looking at it is, if I have to identify a product, and if I have to write a functional requirement for a product, then I should know that what should I comply with in the first place. There has to be a framework. There has to be an architecture in place that is embedded with security, that is embedded with data classification, data analytics, data sharing, and all the nitty-gritty of data. When I say data here, it is about patient data. So we need to identify a framework, and based on the framework, you map the product features that have been around the market. People are selling so many other products. So if somebody says my product supports this, I should have a quantifying or qualifying factors here so that I can compare and say it meets these criteria. So we need to put some governance and guardrails clearly defining what these products are in the context of the ever-evolving threat perceptions in the world. We have to be conscious about that and also create those as input into our framework so that any new product that we try to purchase that says that is going to safeguard our patient information, we have to make sure that we are mapping to a tool or a architecture that tells you whether this product is ideal for you or not.
Akash?
Akash, I'm
Yeah,
sorry, go ahead.
I think one of the best thing what I would mention is, in my opinion, is number one is the awareness program. That every provider should have a compliance officer in his or her office who can give the proper awareness every week. That's usually called a compliance week. I mean, most of the company, along with, my company is regularly following the compliance week. This way we can give the proper awareness program to the employees that how you can protect the patient data and how and what are the covered entities where you can breach out the data along with the proper, the safeguarding measures. So that's the number one solution. What I would suggest is everyone should have a compliance awareness program, compliance week, as well as a compliance officer in the office. And the number second is, that's usually maybe, I mean, you guys are aware of that. I know that Ramesh is aware of that is the MFA, like the multi-factor authentication on the different softwares. We can use that. We can use that, the multi-factor authentication on the patient data I'm talking about. The regular security audits and risk assessment, that's very important, that every office, provider office or other office should have a regular security audits and the risk assessment, so at least they can know that they are not breaching out the patient data. Access control, number third, I would say that's very important. And then, of course, secure cloud storage, because most of the people, as Ramesh, of course, have a big IT background, and he know that like the data storage basically is very important. Like if my office is using they're getting the information from the provider office and then submitting to the insurance company. And if we do not have the proper data storage, it means that's it's a big blunder. It's a big loss. So everyone should have a big data security. This is what I would suggest. So those are the things that the proper, the measures we can use there and in order to protect the PHI. That's it.
I'm just trying to add, I'm trying to be a devil's advocate here. When you said multi-factor authentication, even multi-factor authentication has been taken for a ride around the world. So we should be going around probably the next level of obfuscating the data and then create, on top of that, put a multi-factor. Then what happens is nobody has even if I'm a systems guy sitting in front of the computer, I assume that I have access to every data. But even to me, if I have to update any information, I cannot, because end of the day, I have the multi-factor authentication keys, but I can't change it because the data is already obfuscated at one layer. When the data is obfuscated, he needs to have the permission of the data owner. It could be a patient, it could be another person. In this context, it's the patient. So, I mean, depending upon use cases, again, what I'm suggesting is, if you want to make a hard rule, you better make it a hard rule. You cannot have hard and soft. That's when hackers love to come in and do the damage. So to your point, I agree with you that any additional authentication in place is always a welcome thing. But with multi-factor authentication, say for example, if I put my cell phone as a way of authentication, right? I get a text. These days, people are hacking into the phones and they're simulating another phone with the same number. You get all these fake calls these days, from various places of the world. How are you getting? You try to call them back. Oh, this number does not exist. So precisely, this is how people, as technology is evolving, the devil's brain is also evolving much faster.
Mm.
You and I work from 9 to 5, maybe 9 to 6. A hacker works 24/7 because for him, that is his life.
Well, I have to
Definitely.
disagree with this particular point. I'm a startup founder. 9 to 5?
It's like
Definitely not
it's
9
like
to 5.
6A to 6A, right, Julia? We don't get any sleep starting up, do we?
Mm.
Look, so I have one more question. We know that artificial intelligence and quantum computing, which is quickly coming, will impact everything that we have discussed today, right? What are ways, how is that going to impact us with patient health information? And what are some ways that we can prevent it? Have we even come up with solutions to the artificial intelligence issues? I mean, I know we had a webinar before, and there are some good things about artificial intelligence when it comes to protecting patient health information or data security and privacy, but there's also some weaknesses there also. So help me with that, please.
Julia, you want to take it or can I?
I'll have to
Julia
take
has a
it.
nap.
Thank you.
You.
So, couple of things, and it's actually very
I would say
interesting.
this is the specifically question is Ramesh is for you, I would say, because it's like how we can protect the data through using the AI. So you are the only one who can explain that.
I'll definitely
Oh
add.
no, Julia has some insight.
Yeah. So, well, my 20 years in IT development has also shown some things. But for AI, one of the things which is most important, AI can help us. We shouldn't look at it as a panacea. It's not going to replace doctors, but it can do some heavy lifting. For example, I guess you mentioned the automation that can be done with AI. But one of the things which is extremely important, and that sort of goes, well, almost against what we all discussed today, because we're discussing how to protect data, but also we need to discuss how can we share data safely, protecting patients' privacy, but share data. Because if we don't, the models that will be used on with our doctors will not be trained on our data, and they will not be generalizable to us, and they will be biased. So if I can share one more screen, and I promise that's the last picture. Here's some interesting information from 2020. It was published in JAMA. This is the sources of data that are used to train AI models. So as you can see, a lot of us are not represented here. And actually, if we're talking about, for example, California, it will be Silicon Valley and some of the LA hospitals, but not necessarily the rest of the state. So a lot of times, the data represented in those models comes from a handful of hospitals, like Stanford's and Mayo's of this world. But what about the rural hospitals? What about tribal clinics? All of this information needs to be presented. So in a sense, for me, there's always a sort of a two-prong approach, right? One is we need to protect patients' privacy, but at the same time, we should think about how we can share this data, because without sharing it, AI will not be trained properly. It will not be useful for us, and will discriminate against us because it won't be trained on our, let's say for dermatology, on our types of skins, right? On our particular problems that are specific to different types of population. So that's what I would say about AI.
So Julia, looking at this map, what does the green mean and what does the yellow mean?
So green means that it's more represented. Yellow means it's less represented. Gray is the rest. But what I was saying is that for California, for example, it looks very green. But if we dig deeper, it will be very green here and gray the rest of the place.
Oh,
Silicon Valley, and that's it. There are some New York, some Massachusetts, and some other states, but as you can see, that's a handful. Situation, this is from 2020. Situation has changed a little bit, but not enough to make sure that the models that are being passed by FDA, that are being used and that will be used by our doctors, are generalizable, are not biased.
Right. Did anyone else want to chime in on this question, Ramesh or Akash?
See, AI, I don't see a kind of immediate threat, but the threat it poses is much more larger in terms if we are not be ready addressing that animal much before it starts eating into our data. Because what happens is these simulations, and when we try to use AI for the purpose of analytics, we unknowingly we try to expose a lot of data, because you create those frameworks and say, I'm feeding this data into my AI engine, and then you assume that AI engine is the purest one and is not sharing with anyone, and you're getting it back. But that's not true.
I wouldn't assume that the AI is purest one. Come on. It's created by humans. I don't think anybody assumes that.
No, but so that's the reason for why I'm saying, people have to be conscious before putting in patient information in for any analytical data. It has to be largely done in a model where you can process it on-prem, or use a model that kind of uses only or exposes only data that is not involving PII or any of the HIPAA information. So you have to tame it. It needs some time, but don't have any adrenaline rush in exposing your data into an AI engine. I'm not saying don't rush into that, but be slow without having proper governance in place. What you want to do, do's and don'ts of data processing in AI engines are to be defined clearly by your institution. Otherwise, risk factors are tremendously high. But at the same time, if I talk from the perspective of benefits that you can earn from being exposing your data into for analytical purposes, it's going to have a phenomenal advantage to doctors, to nurses, and more improvement in patient health condition. Because your data is now, you have the cleanness of the data, that you can use it and analyze and be ready to kind of make some positive recommendations to the patient. So this is going to help on the other side. The flip side of that is the threat is also equally dangerous. So we got to be very educated. We have to understand what this animal can do, and how do I make myself aware of managing and working with this animal without with the realization that there is a threat. And what is that threat? How do I overcome the threat? By proper training, proper understanding. And this is very important.
All right. Well, thank you. We do not want to hold you all too long, but I would like to thank you all. It has been such a pleasure tonight. Thank you, our panelists. I am going to let my dear partner close us out.
Yes, so before we leave, we do want to reiterate that at Reassured Workforce Solutions, we understand the unique challenges you face in protecting sensitive patient information and managing critical healthcare needs. Whether it's ensuring the safety of your data or addressing workforce shortages like nursing, these issues can feel overwhelming. but you are not alone. Our SELECT framework, which stands for streamline, evaluate, locate, engage, customize, and transition, was created with your needs in mind, offering customized solutions to fit your organization's specific challenges. We genuinely care about helping you build a secure, efficient operation that thrives. Let's talk about how we can support you, whether it's shoring up your cybersecurity or filling essential healthcare roles. Reach out to us today at www.reassuredsolutions.com. We're here to help you succeed. We thank you guys so much for joining us. We are so glad to have you here. We're honored that you agreed to join our panel, and we look forward to continuing a relationship with you all.
All right, and we want to thank our attendees also for taking time out of their busy schedule to join us. We didn't have any questions in the Q&A today, but that's okay. Maybe you guys told them everything they needed about PHI. Well, we thank you, and I will definitely be in touch with you all. All right, have a good night,
Thank you, guys.
everyone. Thank you.
Thanks, everyone.
Take
Bye-bye.
care.
Bye.
Thank you.
Bye-bye.
Bye-bye.